This is a comment. We're being live streamed, so I got it. Good afternoon. This is Senate Judiciary and Senate Institutions meeting on the subject of placement of difficult to place youth with the Department of Children and Families. At a prior meeting, Commissioner Brown mentioned that they would hopefully have a plan by the first of the year to deal with some of these more difficult kids. And Senator Benning's Committee on Institutions is beginning a deep dive into the problem. Basically looking at how the youth who used to go to Woodside are dealt with. Luckily, it's a small number. We've had discussions with the Commissioner of Corrections about possible 4 beds in Rutland for some youth, but it still leaves a real void. So I turn it over to Senator Benning.
Yes, good afternoon, everybody. I'm Joe Benning. I chair the Senate Institutions Committee. Last year, we took a beginning look, if you will, at the brick and mortar changes with respect to Woodside being closed and what to do with problem youth that might need to have some more secure settings. As a result of our conversations, which were fairly brief, we had understood that there was going to be a facility in Newbury with some conditions that were placed on the state's intent to move there in the event the town did not go along with that suggestion. I understand that there have been objections. There has been a situation where things have entered into the legal world, and the problems for resolving that remain to be seen. But as that winds its way through the legal system, the question becomes, what, if anything, is Plan B at this stage? I think that brings us up to speed with both committees.
Senator, Commissioner, would you like to comment, or Deputy Commissioner Radke?
Sure. So we have a presentation to go through for the committee, and we'll kind of touch on what was just raised by the committee during that presentation. But we thought it would be good to give a bit of a background to our system of care and the different services in placement of youth that we provide those services to kind of frame broad context to this conversation. And so with me today, we have Deputy Commissioner Erica Radke, and then also Senior Advisor to the Commissioner of DCF, Katerina Lasias. And Peggy, I didn't know if you could give Katerina authority to pull up the PowerPoint, and we have another document to show as well.
Yes, I did give her permission.
Okay, great.
I'll pull it up right now. Is that good for you, Commissioner?
Yes, thank you.
Okay.
It's, by the way, it's on the Judiciary Committee website if folks want to follow their own.
Sure. And Katerina, if you could go to the next slide, please. So at DCF, we're really committed to the positive youth development and providing support and services to promote safety, long-term stability, and the well-being of the youth we serve. We recognize the importance of the appropriate setting for youth to meet their needs, whether that be in a community-based care or a residential system of care. And then Erica will take us through a little bit of the next couple slides on the PowerPoint. Erica?
Thank you, Commissioner. Katerina, can you move to the next slide? So good afternoon, everyone. For the record, my name is Erica Radke, and I'm Deputy Commissioner of the Family Services Division of DCF. On this slide, we talk about custody and case types. Children and youths receiving ongoing services in DCF can either be in DCF custody or court-ordered conditional custody, or actually in the custody of their parents while their family receives support. Point-in-time data from September 2021 shows that there were 1,055 children in DCF custody and roughly 470 children in conditional custody arrangements and 320 families receiving ongoing support. And of the children under DCF custody, as you can see, the vast majority were placed in custody due to cases of abuse and neglect and other CHINS matters. The majority of the youths that have been adjudicated delinquents are actually in conditional custody arrangements. So in terms of, where children in custody live, you can see from this slide that most of the children in DCF custody are placed in home-based care, the majority residing in foster care or kinship care. There's only a small percentage, about roughly 12%, that are placed in residential care. Next slide. And as I mentioned earlier, there's just that small number of delinquent youth, a little under 4%, that are actually in DCF custody. Most of them live at home and receive services and supervision under DCF. Next slide. But of those youth, that small number with delinquencies that are under our custody, a little over half of them are placed in foster or kinship care or live at home. And then the remaining youth, that less than half, do reside in residential care. Are there any questions before I turn it back over to Commissioner Brown?
So some of what we're seeing in our systems of care, Katerina, if you go to the next slide, is that the pandemic has been having a real impact across the board in our system of care. It's been hard to retain and recruit foster parents to make sure we have a strong and robust foster system for our children who are able to be placed in the community, which is the vast majority of our children we serve, whether they're CHINS kids, abuse and neglect, or children deemed delinquent, which is a very, very small number of the kids we serve. Also, we're seeing the impact hitting our residential programs really hard. Either just hard for them to retain and recruit staff. That is a serious challenge for many of the programs we rely on. We're seeing outbreaks happen in some of the programs we serve, either with the staff or the youth, which then limits the ability to admit new children into those programs during those outbreaks, which is further straining the system as well. And those impact CHINS kids and juvenile justice kids. We're seeing that happen more and more across our system of care. And then the other area, particularly with kinship, where we put youth, with other family members to help meet their needs and to live with and provide services. Many of them are grandparents, and they are in the vulnerable, the more vulnerable category for, in terms of the impact of the pandemic. And some of our children are in schools, are at risk of catching, even if they're vaccinated, they could have a breakthrough case, or they're younger children who are not eligible to receive the vaccine. And so that's straining our kinship care as well. And we're reevaluating our policies in terms of vaccination for the kids in our care and custody as a result of some of these impacts. But just given the dynamic and our role in these children's lives, it's a policy decision that needs a lot of review and analysis and conversation with our partners. We have been doing a lot of work behind the scenes to stabilize our high-end system of care. And Katerina, thank you. We have been working with Beckett to create a new contract to help them recruit high-end stabilization foster homes and to provide wraparound services. That contract goes into place on February 1st. We're hoping that will help provide some more high-end foster homes and stabilize kids that are able to live in the community, but with a little bit higher level of service. So that will relieve some pressure in the system as well. Also, given the staffing challenges that we're seeing in some of our programs, It's incredibly important that those programs stay viable and open to meet the needs of our children. And so we have been able to utilize an amended contract being used in the Agency of Human Services and on the healthcare side of the field, where they have a contract with a provider, a national provider that provides traveling healthcare resources. So we are now a party to that contract, and we are utilizing traveling healthcare resources to help staff programs in a couple areas of the state. One of those is the CL program, the Depot Street programs in Bennington, and then also a program in Windsor County. Also, I'll point out, prior to being able to bring on board these traveling resources, we were actually using DCF leadership staff and line staff in some of the residential programs to help keep them open and available to meet the kids' needs and other in some of these areas of the state. So you can see we've utilized quite a few hours of traveling resources. We recently just extended that contract. It did run through December. Now that contract's been amended to run through the end of March, and we'll reevaluate at that time if those resources are still needed. It's something we would prefer to make the investments in the program staff, permanent program staff of those programs, given these traveling resources are very expensive, but they are necessary at this time to make sure these programs are able to operate and meet the needs of our case planning. Also, we have several youth who need a higher level, not of residential care, but of mental health care, who really have some acute mental health needs. And the mental health system, particularly for adolescents, is very strained at this point, and inpatient capacity is very limited. And so we are working very closely daily with the Department of Mental Health and other mental health providers to make sure the needs of our youth are getting met and hopefully prioritized so that they're able to have access to inpatient services when those beds become available. The Brattleboro Retreat is really the one inpatient setting that's available for adolescents in the state of Vermont, and they are full on any given day right now. And there is a waiting list of youth that need in that inpatient level of care. I think right now we have 3 DCF kids who need that level that are waiting to get in, and many of them are being maintained in healthcare settings while they're waiting for those beds to open up, given their level of acuity and their mental health needs. Also, we're contracting with a provider to open up a 2-bed program to serve developmentally delayed youth. Make sure we're meeting those youth needs as well. I think in general, it's fair to say that we are seeing an increase in the level of needs of some of the youth, not just in general in Vermont, but in kids in DCF custody. The impact of the pandemic are taking their toll, and we're seeing that in some of the higher acuity needs of some of the kids that we're serving within DCF. And so we're really making sure we're putting in programs and services to meet all of our children's need at all levels of care right now. We've some of our programs to make sure they're financially viable and can compete in the labor market. We are providing new updated rates, increased rates for our providers. Many of our providers are coming to us seeking increases in their rates, and we're working with them to provide them. But also, we've been providing emergency financial relief as well, so that those programs can stay open and viable and meet the needs. So we're making sure that our programs have the financial resources available to stay open and operate and make sure that they can recruit and retain staff. Also,
May I ask questions about, I'm sorry, go ahead.
Yes, go ahead, Senator.
Well, I guess the 2 areas where I'm most concerned right now is the case planning and ongoing communication with DMH, because that's what we're seeing at my local hospital. Our kids who are in need of mental health treatment being housed in the emergency room, and then having altercations with staff, having other helpers. And then the second one is the need for dealing with that small group of dangerous youth who are trying to be housed in the community. But early this morning, we talked about possibility of 4 beds at the Rockland Correctional Facility. Those are the 2 areas that are most heated. And I got something from someone that the Brattleboro Retreat was out seeking contracts with New Hampshire to take kids that obviously would leave us with less room for that group that you identified.
Yeah,
You know anything about that?
Yes, Senator.
Commissioner, can I just interrupt? I need to alert Peggy that one of our committee members is stuck in the waiting room and would like to be admitted. I'm sorry. Thank you.
Sorry, just to say he's not actually in the waiting room. He's attempting to join the wrong meeting. I'm communicating with him right now.
Thank you, Alex.
Thank you, Senator Sears, for highlighting those 2 areas of concern. I can say that you know, the leadership within DCF meets regularly and talks regularly with the leadership at Mental Health and the agency and other partners as well. And also we have teams that meet regularly daily to triage the needs and of the youth that we're serving, and then other youth that DMH is serving, and try to make sure we're matching kids with the appropriate level of placements with the services that are currently available, and then prioritizing them when there are delays in our youth being able to access care. In terms of the contract with the Brattleboro Retreat, New Hampshire has a very peculiar contracting process. And my understanding is that agreement was something that was discussed between the state of New Hampshire and the Brattleboro Retreat some time ago. And just given the peculiar contracting process that it took that quite a while for that contract to go through this committee that all state contracts need to go through, and that contract really is only providing beds when there are beds available and they are not needed by any Vermont youth. So right now, it's not my understanding that they're serving any youth from New Hampshire, and that they would not unless there are no Vermont kids that need access to those services.
Thank you.
Yep.
Senator Sears or Benning, may I ask a question?
Certainly can from my end.
Yeah.
So I'm looking at this and it's always befuddled me why we can pay 1,000 hours of travel time and we can't offer sufficient wages to attract people permanently. I mean, I know that, and this happens in hospitals too, travel time is really, really expensive. So if we're paying for 1,000 hours of travel time and now we've just reactivated the contract, why don't we just offer more money to hire local people and have permanent positions instead of travel? Anyway, it's always befuddled me that we are willing to spend money on travel, but not willing to increase our salaries to get permanent local people.
Thank you, Senator, and your point is well taken, and I certainly would not disagree with that sentiment. And I would say that we are working with our providers to provide financial resources to be able to pay more to their staff, their permanent staff, through the rate process and emergency financial relief, so that they can be more competitive in the job market, and not only being able to hire more staff, but be able to retain more staff. And so we are doing that work on our end in DCF in terms of our residential system of care, and making sure our residential providers can be competitive in the wage and labor market.
Thank you.
Senator
Sears, Senator
I would
Benning, can I
like
ask a
to
question?
add in that, oh, I'm sorry, go ahead.
No,
Yeah, go ahead.
Oh, I just was
yep, go ahead.
I was just going to add in that I agree with you that we are definitely working with the rate setting process to try to get to a more competitive wage. But what we found is that in this immediate short term, we still needed to help these programs get more staff, which is why we called in the travelers, because as we're trying to help the program stabilize, they still needed staff in the meantime due to, COVID, with staff having COVID and taking off or having people resign. So this is sort of a short-term solution that we're working on while we help get them to gain their own more permanent staff in the longer term.
Senator Benning.
Senator Ingalls.
Yes.
Senator Ingalls.
Commissioner Brown, is there a backup plan in case the Newberry site doesn't work? And the reason why I asked that question is because I'm just getting questioned over and over and over why we're not looking at the Windsor site that we've already owned already. So could you help me with an answer to that so I could answer that effectively? Why we wouldn't be looking at Windsor if Newberry doesn't work?
Yeah, and that was the next piece of our presentation, just to update you, as Senator Benning touched on. Our permit with Beckett at the local level with the Town of Newberry's Development Review Board was denied. We disagree with the decision and the reasoning behind the decision, and we have appealed that decision to the environmental court. That appeal will take some time to work its way through, but we still believe that is the right site, the right facility, and the right program and the right provider for what we want for our youth that need that level of care. Certainly recognize that that's a setback and is going to delay the opening of that facility, or, depending on the outcome of the appeal, we might be having to look at a different permanent option. We are working behind the scenes right now. We have a provider who's willing to step in to run a more secure program on the interim. We are working with that provider and other partners to locate an appropriate facility in a community that will meet our needs. We have looked at the Windsor Prison. We've been working closely with the Buildings and General Services on this work. And BGS, along with the other providers, did recently submit a report to the legislature regarding the Windsor facility and its future. And I would defer to that report. And in that report, it makes clear that the town of Windsor would prefer that it not be used for any type of human service type of program, like either corrections or a secure juvenile facility, is my understanding. That not being said, I think the bigger concern that we have is just the state of the facility. BGS has been pretty clear with us that facility is in such a state of disrepair and condition that and just as it was as a facility to begin with, that it really doesn't make sense to make investments in that facility, because it would take a tremendous amount to bring it up to meet what we would need it to meet for our youth, and that would take a considerable amount of money, considerable amount of time to make that happen.
We'd be talking about building a new building regardless of what site, as far as whether it be Newberry or Windsor. But I hear you as far as, again, you might run into the same problems with Windsor as what we might be running into Newberry. And you've answered my question. Thank you.
Yeah, and I would say in general, I think other programs within the agency that they support, whether it's for substance abuse or serving developmental disability, group home settings, are really facing challenges in siting across the state. And as Vermont has moved forward with what I will term deinstitutionalizing over the last several decades and trying to become a more community-based oriented service provider and meeting folks we serve's needs, we are running into more and more resistance in terms of siting of these small residential type facilities. And it might be something I would recommend that the legislature revisit, and whether there's more needed to do in terms of legislation to support the development of these facilities. One of the areas that the town of Newberry, just for instance, even though the state of Vermont is funding would be leasing the facility in Newberry and funding the operation through a partner. The Development Review Board found it's not a state-owned and operated facility, even though it would be, we'll have an option to buy it. We'll be, spending millions of dollars to renovate it and millions of dollars a year for a provider to run it. So the protections that are in statute now might not fit the current framework of how the agency provides services in the community. It's been for a while now moving away from state operated facilities into more community-based facilities, but with state involvement. And that might be an area that I think needs reevaluation at some point by the legislature, because other facilities are running into similar concerns in other areas of the states.
May I follow up?
Yes.
Following up on Senator Ingalls' question, I do understand, and I understand that Windsor doesn't want it and Newberry doesn't want it. And you said that you were working with somebody, and I'm not sure who, to provide an interim. Why would we, if we can work something out where there can be an interim, we're talking about at least 2 years down the road for, even if Newberry gets on track, right? If we can provide an interim for 2 years in a community and with a provider, whether it's Beckett or not, that is willing to take this on, why don't we just make that a permanent solution instead of interim and then continuing the battle in Newberry?
That's a great question, Senator. And I think as we're approaching an interim plan, we are with that in mind that it could be a longer term solution. And so that is some of the work that in the conversations that are happening is, what would be the longer term outlook for if we leased or purchased a facility or that provider did that, and what renovations would we want to make in the short term to make it viable? And then depending on what happens in the future, would there be further investments or modifications we'd want to use that facility? And so those conversations are happening in terms of the different options we're looking at and evaluating. Is some would be very short term, and some could meet a longer term need. And what level of investment in those longer term needs makes sense given the current state of where we are. But I mean, your point is well taken, Senator. But those are the conversations that are happening.
If I might, just as kind of a response to this conversation, I'm really troubled by not having the understanding of we have an immediate crisis that has to be dealt. And I'm acutely aware of that crisis. CEOL is in my district. There are multiple Beckett programs in my district, which deal with girls, which are putting added stress and strain on all the systems down here. And I think we have an emergency problem that has to be dealt with. But one of the things that I'm proud of developing over the years in Bennington is community support for these programs. And unfortunately, that's in danger right now here in Bennington. But it's something that Beckett never did in Newberry, with all due respect to them. And I brought this up to them personally during meetings with our committees over last year. It does take community support. And if you're not willing to get out there and meet and answer questions from the community, it doesn't happen. But I do think we have an emergency. We have a problem that needs to be addressed now. It can't wait a year for Beckett to open, and I agree with you, Senator White. And I'm appreciative of the efforts of the commissioner, deputy commissioner, and the entire DCF. But I think part of the problem is that the emergency is now, and they have the State Employees Association after them because workers are being placed in what they claim are dangerous situations. We have the local hospital, at least in Bennington, concerned about what's happened and assaults on staff there. by some of these teenagers. And so it's like a perfect storm, and it has to be dealt with. And it's just not something that calls for a year's planning. And I'm not going to fix blame for why Beckett didn't work or why it's taken, from the time we first discussed it last year to now, and we're still no further ahead. We're actually now at least a year away. I just, I think that was my purpose in bringing us here, to try to get us all to understand we have an emergency situation. DCF is doing the best it can, but we need the entire Agency of Human Services behind us. And I thought the questions about Windsor, Windsor doesn't want it, but it's at least 5 miles out in the wilderness, and it is owned by the state of Vermont.
Senator Sears, could I ask that the PowerPoint be taken down for a moment?
Senator, if I could just weigh in a second, Senator Sears as well. Senator Benning, I don't want to interrupt you though. I apologize.
It's okay. The issue for me, Commissioner, is on our committee, both the state and Beckett left it with us that if the town was unwilling to host this facility, that the plan was going to shift to something else. And there are a lot of people who are anxious to come and explain why things didn't happen. And Senator Sears is 100% correct. This is a problem statewide, and people are having a direct impact, especially the state employees who are running into severe problems. So I don't know what it's going to take to get this to the top of the burner. Maybe it's already there. But for sure, we're going to take a deeper dive on this next week to follow up what Senator Sears has just been walking through and try to get this moving as quickly as possible. I just wanted you to be aware of that. A lot of the folks who are surrounding Newbury who came to testify and are upset about the process and how it worked will be joining us to have a conversation, and the State Employees Association as well. So this is, it's a conversation that needs to be had, and we need to resolve it. It's that simple. I'm done. That was my rant, Dick.
Oh, I appreciate that. I guess, yeah, I think we need answers quickly. And again, I think we've offered a couple of suggestions, one being 4 beds at the Rutland Correctional Facility for dangerous youth, and the other being what can be done to open up beds at the retreat or to provide more beds for those in need of psychiatric care. If I might just read from an email. While hospital emergency departments treat all who arrive for care, most are not equipped to handle a long-term influx of troubled, sometimes dangerous juveniles who are left for numerous days, even though emergency treatment is not required. When these individuals stay for an extended time in our emergency department, challenges escalate, such as keeping staff safe and having space and resources available to care for patients with true emergency conditions. Our experience and what we've learned from others is that the juveniles arrive from various parts of the state to treatment facilities who may not be equipped to handle their needs. Ultimately, these juveniles end up in our emergency department when these facilities are overwhelmed. Often they become the responsibility of the local police and the state's attorney during the course of each situation. I don't think I can express it any better than that as to the immediate problem that we face that must be dealt with.
If I may just jump in here, I certainly appreciate the sentiments being shared by Senator Benning and Senator Sears, but I also want to be very clear that standing up a secure facility will not resolve many of the concerns that we're discussing here today. Many of the kids would not be appropriate for a facility like that because many of the kids in crisis right now are CHINS kids in these residential programs, and they would not be suitable for a locked program. By law, they were excluded from Woodside when it was open. Also, many of the youth are in mental health crisis. And just like any parent and custodian of their children, you seek appropriate care and services for those youth. And so if a child goes into crisis, you bring them to a healthcare provider. And that's our obligation as a department, is to make sure the kids that we're serving get the same access to the same services, make sure their needs are met as any other youth in the state of Vermont, where we stand and act as their parents. And that's what we're trying to do here, is make sure our kids in our care and custody are getting access to the services they need. I certainly look forward to the conversation next week, Senator, with the Southwestern Vermont Medical Center. I'm certainly happy to work with them to problem solve and to see what resources we can help support them with. But at the end of the day, when we have a youth in crisis and they need healthcare, it's our obligation to make sure they get access to that healthcare. And we are not alone in the state, in Vermont, in this. In our conversations with our neighboring states and states across the country, the pandemic is creating challenges across the board, and even for states that have a facility like are struggling as well to meet the needs of all their youth. It's really the pandemic, and that's where our focus is. But also our focus is also on we recognize the need for a secure facility for the very, very small number of youth that need that level of care. But right now, the greatest impact in the state of Vermont is the impact across the board on our systems of care. And it's our obligation to make sure we're addressing all of those. And we are doing that. And we are prioritizing all of those needs at once and working as hard as we can to address those needs.
I want to make clear, I never suggested that it was your fault, nor did I suggest that it was DCF alone. I realized there was a pandemic. I realized the problems. But I thought that when you raised the issue of working with DMH, I suspect that's where much of the problem lies, is that the Agency of Human Services siloed out many of these kids. And so those that should, that would have been before the Crawford decision would have been at Woodside being dealt with. The Crawford decision had as much to do with Woodside as well as the staff there. Had as much to do with the demise of Woodside. And I'm certainly, you came in after that happened. And obviously the deputy at Radke did as well. But we have a crisis, and that's what I'm trying to say. And I understand the need to use an emergency room, but when there's no other place and the kid is held in the emergency room for an extended period, that's where the problem is. That's why I was asking about Brattleboro Retreat, New Hampshire, and all that.
Thank you, Senator.
Yes, thank you, Senator. And that is an important point. And I would just like to add that in terms of when we do have a youth that is in crisis and they do need to go to the emergency room, when they're screened in, they do get the treatment that's available. But we also do then continue to look for placements when they're not able to go to the retreat. We even look at placements out of state in order to try to find somewhere for the youth to go to get that treatment that they need. But as the commissioner said, since this problem is just really nationwide, we found that many of the other programs don't have beds either. And I would point out too that when we have a youth in crisis that doesn't screen in, since they are our responsibility, we do keep them and continue to take care of them with our own staff and with sheriffs when available as well. So it's not as if we're just leaving our youth there at the emergency room without cause.
May I ask?
Senator White. Yeah.
So this may be a stupid question, but I know that a couple of years ago, we funded 10 more, I think it was 10 more level 1 beds at the retreat in what used to be called Linden Lodge. It's across the street from the retreat. Do we know if those are secure beds because they're level 1 psychiatric beds? I don't know that we need, and at the time, the retreat actually said that we needed more step-down beds. We didn't necessarily need more level 1 beds. Are those all in use right now? Or could those 10 beds be used for this purpose?
My understanding, and I would probably defer to my colleague, Commissioner Hawes at the Department of Mental Health, who's more in tune. But my understanding is well over a year ago, the retreat was experiencing financial difficulties, and they closed at least one program to serve adolescents. And so there's currently a unit being unused, and that's some of our work with the retreat is what can it take to bring in additional staffing to open up some of that unused capacity in their facilities.
Right, those are different beds. That was an adolescent program that was unceremoniously shut down by AHS, I will say. But the 10, and that program was on the main campus, but the 10 beds that I'm talking about are across the street in what used to be called Linden Lodge. And it was voted on by the House a number of years ago to add those 10 level 1 secure beds. And I don't know if they're in use, but if they're not, those are secure. They're both staff and building secure. And if they're not being used, if we don't need them for level 1 psychiatric beds, I don't know.
I will connect with our partners and get back to you on the answer to that question, because I do not have that specific knowledge myself.
Thank you. And I'm just going to add one more thing. I would also, if we're looking at reopening an adolescent unit at the retreat, why aren't we looking at doing that permanently then, instead of just, and as Senator Sears said in Bennington, he has worked really hard to get the community behind this kind of services. And I would say the same is true in Brattleboro with the community welcoming services for kids in crisis, adults in crisis. So just a comment.
No, your point is well taken, Senator White. And I would say that we recognize that many of the programs we operate in the department, and I'm moving broader than just the Family Services Division now, in response to the pandemic. The expansion or the change in those programs is certainly creating stress in communities across the state, whether it's the emergency housing program or our residential programs are serving kids with greater acuity or having staffing challenges, and that does put pressure on those community first responder and healthcare resources. We shared some of the work we've done here to help kind of stabilize our providers to help meet those kids' needs, but also we've been working with a security consultant, because some of those areas have involved, as Senator Sears, in police responses, and we want to make sure we're working with our community partners as well in those conversations. And I meet regularly with the chiefs of police in certain communities or with leadership in other communities across our programs when issues pop up to see what we can do to help meet their needs or make changes, to provide a better service and lessen the impact. Senator Sears says one of those conversations is happening next week in his area with the hospital, and I look forward to that conversation. But those conversations are happening regularly across the state, whether it's due to the impact of the emergency housing program or our system of care. And we will continue to do that as long as necessary to make sure we're meeting the needs not only of our kids and our providers, but also the communities that host some of these services as well.
Thank you, Commissioner. I truly appreciate both you and the deputy commissioner coming here and giving us this update. It's a challenge, and I recognize that challenge that both of you face. But I'm hopeful that the institutions committee's deep dive will help us better understand what needs to be done, particularly in terms of the psychiatric issues that you have kids who are in custody that did not commit a crime who have significant psychiatric issues. And I've always seen the problem there between the Department of Mental Health and in some cases Dale and the Department of Children and Families. And it's like, you guys got stuck with it. And you need help from your partners in AHS too. And a lot of people missed the impact that Judge Crawford's decision had on Woodside and their ability to deal with certain kids, and the behavior of certain staff at Woodside that led to those allegations as well as those findings by Judge Crawford. So I think we can't forget that in this whole conversation.
You are correct, Senator. Many of the kids in mental health crisis, even if Woodside was open, wouldn't be, even if they were juvenile justice kid, wouldn't be appropriate, and Judge Crawford's decision really highlights that issue quite well.
I think when, hopefully when Judiciary, institutions, health and welfare, and whomever else looks at this crisis, they'll also look at that particular group that may be, like in the adult world, corrections is the institutional last resort. And it seems like in many cases in the juvenile world, DCF is the institutional last resort. We have to change that.
So we do have a few areas to touch on of our presentation. Just wanted to share some of the other, I want to recognize our family services staff. They have been asked to step up and work in ways and serve youth with a higher level of acuity that we have seen in a long time, probably never in our system of care, given the impact. And our staff have stepped up. And so we're seeing CHIN's youth being asked to leave foster placements or residential placements at inopportune moments, and our staff need to step up. Some of them, need to be staffed in apartments with law enforcement or with our staff until we can get to the next business day, so that we can get them into a residential program. Many don't accept new admissions except during business hours, and so our staff have stepped up. And I want to recognize the work of the staff. It is asking a lot of our staff, and they have stepped up across the board, whether it's the other area I would say they've stepped up is, given if a juvenile youth is picked up in the middle of the night or a weekend, we have agreements in place with law enforcement to staff them with in apartments we've secured in areas of the state until we can get them into court and then assess what's the right program or placement for them longer term. And we ask our staff to be there with law enforcement to manage those youth as well. And one of the things we've encountered, and it's getting better, what really hindered us early in the pandemic, but working with law enforcement, sheriffs, we're also working on a new contract with a in-state secure transport provider. Is transporting our youth after they've been picked up has been challenging, where we've needed to wait long periods of time for a transport team to arrive to move youth. And we ask a lot of our staff sitting with them in police departments or emergency rooms or in other programs, depending on the circumstances. And that's why our work to stand up an interim solution is so important. That facility would bring more stability to the system in those circumstances. While they're rare, they are challenged. They can be challenging when they do occur. Also, to help relieve the stress on our team, we're working to bring in retired staff or other staff on a temp basis who have training and skills to work with youth so that we can not rely on our existing staff so heavily. We're working to bring additional temp resources on to handle that load. We also have been in conversations with an out-of-state provider who is a for-profit provider, and they provide mental health care, more higher level like inpatient care, wanting to establish a program in Vermont. We're working to see whether that's something the Department of Mental Health and DCF and Dale Disabilities, Aging, Independent Living are in conversations with this provider. Space again is one of those limiting factors in that conversation right now. I mentioned the transportation. And I'll say, the pandemic has really broken down barriers within the Agency of Human Services. I work much more closely and regularly with my colleagues, commissioners and deputy commissioners, and our teams on the ground as well, between the Disabilities, Aging, and Independent Living, Mental Health, and the Department of Corrections. And one of the things we're working closely with DMH is to try to bring some additional healthcare crisis stabilization programs back up to full capacity. Those that are short just of inpatient hospitalization. Some of our providers there, again, have been hit with staffing. Our designated agencies are really struggling with staffing right now, which really, limits their ability to fully provide those crisis stabilization programs. And so we're working with our partners there as well. And then to support our team, Erica, I don't know if you want to touch on some of the work we're doing right now to help support our team at FSD, who have done a phenomenal job, and I have tremendous respect. And it's probably the hardest job in state government, is being a social worker within the Family Services Division.
I really do have a great team, and it's important to me to recognize the hard work that they've been doing. And as the commissioner said, how they've stepped up during COVID and staffing youth that are COVID positive, or also staffing youth, high-end youth in different situations, either in apartments or at emergency rooms. And what we've been doing is we've developed a workforce development group just to brainstorm some ways to show our appreciation for our staff, as well as looking for ways to retain our staff and to also hire additional high quality people. And some of the ideas that the group has come up with is pay incentives for staff members that are staffing COVID positive youth. We're also contemplating creating a specialized response team that would be eligible for a yearly stipend. And we got that idea from DOC. And what this team would do, I'm envisioning them having specialized training and being able to mobilize and support youths that have emergent needs. And another thing that we're also considering is utilizing the designation of senior FSW. At this point, we only have a few left, but really re-energizing that designation that would be for more seasoned workers that could stand to have increased pay, but that they're not necessarily interested in managing people, but that we're recognizing their skills and their talents as a way of keeping them around, because we absolutely need them. So what we're really looking to do is find creative and innovative ways to find out what the staff needs in order to make sure that we have a real positive work environment, because I do have a great team, and I really want to make sure that we keep it and that we grow it.
And then there's just one last piece of information we wanted to share with the committee. And I know this has come up in other testimony of what residential programs we use in state and out of state, and the youth in those programs. And Katerina, I didn't know if you could pull that spreadsheet up just so we could share that with the committee.
Yep, can you see that now? I can make it a little bit larger if that's better.
Yeah. And so here are the programs that we use in state, and then below are out of state. and you will see the name of the program, the number of DCF youth placed there, whether they're a CHINS youth or they're a juvenile justice youth, and then a description of the program and who they serve and what type of service they provide. Very general, high level. So if you can scroll down, so you'll get a sense here, and I believe we provide this to the committee. So we have 71 kids in in-state programs right now. 60 of those are CHINS kids, 11 of those are juvenile justice kids. And then if you scroll down, you can also see we do rely on a number of out-of-state programs, particularly for kids who are struggling with very unique needs, that we just don't have a large number of kids with those same needs, that where we could, it makes sense to have a program created in-state to meet them. And so you can see we have 50 kids in out-of-state programs right now. I'd really love to continue to reduce that number and provide more services in-state. But we have 40 CHINS kids in programs out of state right now and 10 juvenile justice kids. And so that gives you a sense of the programs we're utilizing for our youth, the number of kids we have there, where they're located, and kind of a high level of what that program focuses on for service. And
May I ask you what TX means?
Treatment.
It's, treatment. Oh, okay, thanks.
I think we're supposed to be on the floor at 1, and we're
We
close
are.
to that. So,
Well, that wraps up our presentation, Senator. Thank you. We really appreciate the opportunity today to have this conversation.
thank you. Thank you very much. And
Thank
Senator
you.
Benning and Senator, I don't see Senator Lyons here, but I see Senator Hardy and other members of Health and Welfare. Thank you all.